there is this transformative potential of AI in improving personalized treatment, in enhancing the equity in care. This is a landmark trial where AI is supporting breast cancer screening radiologists. And the impact is a 29% increase in breast cancer detection, with no increase in recalls or false positives, and reducing reading workload by almost half. And I'm very happy to share with you, as a radiologist, also moving in the field of AI, the future of AI in medicine. So let me see. Okay, we've heard this from several speakers already, the large burden of cancer on society. In Europe, it is really a large burden because although Europe only accounts for 1/10 of the world population, 25% of cancer cases are in Europe. So we need to take actions, and we've already seen that over the past 10 years, an increase of 25% was noted in people living with cancer or having lived with cancer, and projected to be very increasing even more, up to 2,000 people per 100,000 living with cancer in the coming 5 years, and leading to an increase in per person cancer care costs by 2050 in EU itself of over 50% already. So the challenges are obvious. We need to work on this. And it's also because there is an increasing personnel workforce shortages, while there is increasing administrative burden. So we need a more efficient, preventive and patient-centered care. The European Commission has focused on prevention within two major investment programs. One of it you've heard today already about the Europe Beating Cancer Plan. And linked with that is the cancer missions, with the idea of investing in cancer research and innovation program that will have direct impact on patients. So I was part of this mission board, and we co-created programs that would have the patient in the center. And 3 of these pillar programs were prevention, early diagnostics, and digital care. Because of the success of this mission program, the European Commission also focuses now on Safe Hearts Plan, which is focusing on prevention of cardiovascular disease. Now, why is this all? It's obvious that we are getting very good in curing, prolonging survival of patients with cancer, with all new technologies. But obviously, and that's why we are here, the biggest impact is if we go and move towards the field where cancer is still in the asymptomatic phase, or where we can find tumors that have not been invasive cancer yet. And of course, the biggest impact is if we go to the primary prevention, removing triggers of initiating cancer. Now, the European Commission also focused on Digital Europe. It has secured 9 billion and even more in total for digital transformation. And the reason is obvious. There is this transformative potential of AI in improving personalized treatment, in enhancing the equity in care, because it brings specialized care into the regions with less resources. It can improve access to screening, and it improves workflow efficiencies. This is a landmark trial where AI is supporting breast cancer screening radiologists. The trial shows that if you add AI to stratify for either one single radiologist together with AI or double radiologist reading together with AI, that experimental arm is doing better than the standard arm where you have two radiologists screening breast mammographies. And the impact is a 29% increase in breast cancer detection with no increase in recalls or false positives and reducing reading workload by almost half. In the colorectal cancer screening, we see that 50% of the screen detected colorectal cancer are stage 1 disease. So the debate is whether we should always perform wide resection. But if we want to go for organ preservation, we need to have methodology that really target the small tumor volumes. So non-invasive methods. And we cannot do that with morphology, with CT scan. We do have new targeted imaging, especially the FAPI-PET is very promising. It consists of fibroblast activation protein inhibitor that targets the cancer-associated fibroblasts. And so if you attach gallium, then it becomes a very strong, powerful tool to detect the small tumor volumes. You can see there the same patient with FDG PET and FAPI-PET. You see the difference that the FAPI-PET does not have this background uptake so much. So you see the very tiny tumor volumes very well. But also in the area of treatment, we need very specialized tools to identify residual disease. And we've heard about the organ preservation achieving complete response. We know that that has had a tremendous impact on patients who did not necessarily need to have surgery after complete response to neoadjuvant treatment. And that organ preservation is now central in the treatment of patients with rectal cancer. So for all these, you will need to have precise stratification and response evaluation tools. We will have more organ preservation. You've heard about new neoadjuvant treatment like immunotherapy, chemotherapy, combination of radiotherapy and immunotherapy. So all of these will help us push forward medicine, but at the same time, it will also ask from us, if we are going to defer from surgery, very accurate assessment and stratification tool. This trial has been shown to you several times in rectal cancer, in dMMR rectal cancer, the enormous potential of immunotherapy for a response of the tumors. Complete response by Andrea Cercek's trial. But you can also see what happens. There is, in the upper row, you see the endoscopic image and a very clear response, a complete response of the tumor. But on the lower row, you see the MR scan, and the MR scan still shows residual mass. And we cannot differentiate between immune inflammation and residual disease. So this is going to be the next question for diagnostician. How to assess response in the new area of treatment, in the prevention treatment. And I believe that we move away from only morphology, but combine all data that we create from every tool and test as long as we can have it digital. So we use an AI platform to fuse this data and to combine and make multimodal AI models to predict the outcome. And that is the paradigm shift in the diagnostic world into the integrated diagnosis, where we fuse all data with an intelligent framework, the AI framework. It has been shown already that the integrated diagnostics supported by AI, that it covers the entire patient care pathway from the beginning, from screening and early detection, towards staging, towards treatment and follow up. So it is even more powerful than any technology that has already been launched. It also helps us to move the field in outside the hospital walls. So because we have AI, we can model also all the data, not only the patient data, but also the data of the behavioral data, the lifestyle, the environmental, the social data. We can model that and combine that into a model that can predict disease before it strikes and give guidance for healthy lifestyle. So we, because of AI, we will be able to manage not only sick individuals, but also healthy individuals. And we operate and move into the field of prevention health. And this is already a tool that exists, a European project that has built successfully an AI tool by combining all data from patients, cardiovascular patients, and wearables, every behavior. And this tool predicts the risk for obesity-related vascular diseases and can provide the elderly and the cardiovascular patient insights in own lifestyle and health risks. And that is why also the EU Commission is going to invest a lot in the Safe Hearts Plan, which is the equivalent of the mission plan, the cancer mission. And it will especially secure millions for AI research in prevention and care of cardiovascular disease. So for AI, we need a lot of data. And we realized that. So the radiology community in Europe is leading this huge flagship initiative of the Europe Beating Cancer Plan. It's called the European Cancer Imaging Initiative. The whole idea is to build a federated infrastructure to upload millions of cancer images, literally the cancer images itself. So not the data on when the images were done, but literally the raw data, the images, to accelerate the development and validation of AI solutions. And I think this is very important to build further on AI innovation, apart from all the regulatory aspects and the European Health Data Exchange. Those are all initiatives that need to be done, but most importantly is to build trustworthy data and AI models. So in this initiative, we are also within a European project uploading all large-scale, high-quality data set from breast cancer screening over all Europe, again, to test innovative AI tools for improving breast cancer diagnosis and care. And with all the AI innovation, then the next step is AI deployment in the EU healthcare. So the EU wanted to know how is the situation in Europe? Well, a little bit disappointing, really, because there was a 25 increase in FDA approval of AI tools, 75% being imaging tools, but only 5% of hospitals really deployed these AI tools. The barriers were, apart from the technological that everyone expects, mainly organizational. So the lack of strategic directions and resources, no direct involvement by the end users, the clinicians, and of course, trust issue and lack of AI literacy. So the true problem in AI is the deployment. That is a present demand, but there is no deployment at scale. And that's why the European Commission is moving towards the AI implementation phase with this newly launched Apply AI strategy of the European Commission. And it has one flagship initiative in the sector health, and the flagship initiative is to build a European network of expertise on AI deployment in healthcare. And the project which I'm privileged to lead is the Compass AI. So Compass AI will advance the implementation of AI in healthcare. The idea is to bring all stakeholders together to identify the barriers and the success factors of the deployment. Then, based on that knowledge and on the knowledge from literature, build guidelines to how to move from research towards deployment in hospital. So in the end, we will pilot those guidelines in different hospital settings, both in the advanced hospitals, meaning hospitals which has a very good infrastructure, and in remote hospitals, and even in primary care. These guidelines will be fine-tuned and individualized, tailor-made per clinical setting. And we will then come up with a network, which basically it will be a digital roadmap where you as a hospital could click on that map and get in touch with, that is the hospital of my profile. What was it that they faced? What were the challenges and what went easy with the deployment of AI? And with that, we hope to be able to learn from each other and build an EU-wide interactive network and reference site. And we will also translate these guidelines into policy recommendations for the European Commission. And with this, we hope to prepare the European healthcare systems for full-scale deployment of AI. And within the Apply AI strategy, the next flagship initiative is already ongoing and calls are open, and it is linked to the Compass AI. So our guidelines will be used to have all the screening centers in Europe use that for implementation of screening tools powered by AI. This European AI-powered advanced screening center will focus on prevention tools for cancer and cardiovascular disease. And the call is now open to join this network. And there are also calls to literally submit a proposal of how to implement the AI tools that you probably already have developed in the network. So I think for this, it is clear that if we want to move forward, we need a more efficient preventive patient-centered care. And the moment is now, because I believe that it is the digital transformation of healthcare that can move us forward in a significant way. And for me, it's a strategic necessity and not anymore a question or a future goal. It is a societal and leadership challenge, and rather than a technical challenge. So we leaders are responsible to build strategic alliances in science, healthcare, education, and policy, because I believe that leadership will determine the speed and scale of impact. Thank you for your attention.